Okay, so today I'll be showing you what kind of plans are available in the Covered California and what's the best way of selecting a plan. So on the CoveredCa.com, you will see a tab saying Shop and Compare. Go ahead and click on that. And this is really, we'll just run over a little quote. So let's say you live in San Francisco, for example, and your income is, let's just say $40,000 a year. Although with that income, it's going to be really hard to go by in San Francisco. But let's just assume it's $40,000. Let's say there are two people in the household. One is, for example, 40, the other one is 32. I don't know, just made up some numbers. All right, so let's see what plans we have available for these variables. Okay, so yeah, let's go ahead and preview plans. Here it lets you select if anyone in the household is pregnant or blind or disabled. We'll just skip that. So let's go ahead and say preview plans. Okay, we'll skip that. All right, and here are a few plans available in San Francisco. So we found 31 plans for a family of two living in San Francisco. And for an income of $40,000 a year, they can get a tax credit or a subsidy of $580 a month, which is quite a lot. So there is the CCHP, Kaiser Bronze, and then there is high deductible Kaiser. So those are high deductible plans. As you can see, they are cheap, but you really pay a lot if you see the doctor. Look at this deductible, it's $9,600. It's a lot. I think that's for the family, but it's a lot. Okay, so let's just compare a few of the plans. Let's say you want to look at Kaiser 60. What else is here? Let's select silver plans just so we can compare. Let's select Oscar 73, for example. Let's go on the second page. I want to add another plan that has no deductible just so we can see. All right, so let's add a PPO plan. Okay. All right, so you can add up to 3 plans, and then we'll click Compare Now, and we'll go over the plans. Let's just hide that because that's not very relevant. So we have 3 plans which I'd like to compare. So we have Kaiser Bronze, it's a high deductible. We have Oscar, EPO plan, and then we have a PPO plan. Now, a lot of the time I've been asked, what's the difference between HMO, EPO, and PPO? Well, HMOs are basically health maintenance organization like Kaiser. You would need to get a primary care doctor, and you would need a referral every time you want to see a specialist. With a PPO, you really can go to, you can go to one primary care doctor, and then you can go to another one. You're not required to select it, although I think I'm seeing lately that that's one of the requirements implemented. Another thing is with PPO plans, you don't need a referral to see a specialist. And another good thing is that even if the doctor is not in network, you can still see that doctor. Definitely you'll pay a little more, but you can still go to an out-of-network doctor if you have a PPO plan. That's not the case with the HMO, right? So the EPOs is really like a hybrid between these two. You will need a primary care doctor with an EPO, most likely, although you don't need a referral. Okay, so let's go into the details of the plans. So really, the way I like to compare is by looking at the deductible, right? And that's very important, especially with the high deductible plans. So the bronze has a $6,300 deductible per year per individual. For the family, it's basically more. It's double. Silver 73, the deductible you can see is $2,200 for the individual, and the gold plan has no deductible. The plan that has no deductible is platinum, but we basically did not include it here because really the quoting system allows me to only compare 3 plans at a time, and I really to cover one of each as much as I can. All right, another good thing is to look at is out-of-pocket maximum, right? So what does it mean? The out-of-pocket maximum, you can see, really includes everything you have to pay out of your pocket per year, and that includes deductible and copays, right? And everything else, co-insurance, copays, right? So let's say if there is like a hypothetical situation, there is a let's say like there's a surgery, right? And the surgery is $50,000, and you have a bronze plan. Basically, all you pay for that surgery is the maximum out of pocket. The rest is paid by the insurance company. I mean, obviously, if you don't have insurance, then you pay the entire amount of $50,000. All right. So that's really the beauty of having a health insurance plan. Even though it's a high deductible, it still works. All right, so moving on, let's look at the doctor's visits. So I'm just going to go ahead and close that. So, oops, so we can see plan by plan. So with the bronze plans, you are basically entitled to 3 visits per year, and you pay a $75 copay each time you see the primary care doctor. If you go the 4th time to the doctor, you would basically be paying the deductible. This deductible that we were talking about, right? So you'll basically pay the full cost for that visit if you go to the doctor the 4th time with the bronze plan, right? With this, you don't really have limits on how many times you go to the doctor. You can basically go to the doctor every day. As long as you pay $30 copay, you'll be fine. The specialist visit is a little higher. So for the bronze is $105, silver is $55, and it's the same for the gold, right? So, and then you can see that the other practitioner visitor is basically that's the price for that, the copay. So getting into the copay is really a fixed dollar amount you pay for the office visit each time you see the doctor, right? Now, one good thing with that came with the Affordable Care Act is that the preventative care, screening and immunization is at no charge. So even with the bronze plan, you pay nothing for preventative. So that's very, very, very good. All right, so we covered that. Another important thing is to look at what you'll have to pay if you have a lab test. So you can see the prices here. Again, look at each plan, what it covers. Prescription drugs. So basically with the bronze plan, you pay everything out of pocket. So really the reason why is that bronze plan is a high deductible. It assumes that people that are buying these plans, they are healthy, they don't really need medication. So, in case they do, they cover the cost, but they pay less each month, right? With the silver and the gold plans, you should basically look at what is the copay for that specific medication. So there are 4 tiers: the generic drugs, which are considered the cheapest. You'll pay $15 for the silver and gold. The preferred brand drug, $50, $55. And then the non-preferred brand is $75, $75, and those are the expensive ones. The specialty drugs, which you pay 20% co-insurance. So the co-insurance is really a percentage. If you look here, it's really a percentage, right? Not a dollar amount. All right, so we covered that. Let's move on outpatient services. You can see it's pretty standard. You pay everything after the deductible. Here with the silver and gold plans, you pay 20%. I have to say this is enhanced silver, not an actual silver. It's enhanced silver 73. You only get enhanced plans if you qualify based on income. All right, so let's move on. Emergency and urgent care. That's a very typical charge that usually people get burned by very expensive emergency room visits, right? So with the bronze plan, obviously you pay the deductible, so you basically cover the entire emergency visit out of your pocket. With the silver plan enhanced, you pay $350 copay, and with the gold is $325. So it's still not cheap. So I highly recommend, if you can walk, talk, and breathe, definitely go to the urgent care instead of the emergency room, because first of all, the cost. Obviously, when it comes to medical care, the cost should be on the second, should not be a priority, but yet some people believe that if they have a running nose, that's an emergency. That's not. I mean, it's really be saving yourself a lot of time and money if you go instead to the urgent care. So you can see, even with the bronze plan, you pay $75 for the urgent care. You don't touch the deductible, right? And whereas if you go to the emergency room, you basically pay everything. And we know how much the medical care could be very expensive. So we covered the emergency right there. Hospital. All right, so hospital, basically with the bronze plan, you pay everything out of pocket until you reach that deductible and out of pocket maximum, right? And with the silver and gold plan, you pay 20%. The same rule applies, but you'll be paying less from your pocket. Now let's move on. Again, mental and behavioral health is covered. So there is an outline. You can look at your specific case and see how much you'll pay for certain services. I'm not going to go into the details, but that's very important that the mental and behavioral health is covered in the health insurance. So we got through that. Pregnancy. So prenatal care is covered at no charge, and again you can see the details, how much you pay for the labor and delivery. Okay, so let's move on to the special needs. So such things as home health care services, outpatient services, rehabilitation services, habilitation services, skilled nursing facility, durable medical equipment, hospice services, acupuncture, rehabilitative speech therapy, rehabilitative occupational and rehabilitative physical therapy, and all that good